The kidneys are bean-shaped organs about the size of a fist that are located near the middle of your back below the rib cage. The kidneys filter out waste from the bloodstream, sifting through around 200 quarts of blood each day to remove roughly 2 quarts of water and waste products from the blood. The kidneys send this waste to the bladder to be held and ejected from the body as urine. They also released important hormones such as erythropoietin to make red blood cells, renin which regulates blood pressure, and the active form of vitamin D.
The kidney separates harmful substances from the blood in the body. When this malfunctions, it can be very dangerous. It is possible to live with one kidney, but when both fail, the blood is not filtered, leaving the body at risk for many side effects. So a kidney transplant is necessary at these times. Symptoms of kidney failure is reduced urine output, fluid retention, shortness of breath, fatigue, confusion, nausea, chest pain, or weakness. 10% of the adult population in the United States have had some form of kidney disease. Not all of these cases will result in a transplant, but this issue is still very relevant. Throughout history, organ donation has been a controversial topic, especially when the donor has passed away and is not able to say for themselves what they want to do with their organs. There is a rumor that if someone registers as an organ donor at the time when they receive their license, that doctors may not work as hard to save them because their organs can be used to save many other people. Some people look at it like the death of one person can prevent the death of many others. However, this rumor is very untrue because of the ethical dilemmas in which it prevents. Doctors take an oath to do no harm. Their job is to make the person better than when they first came into contact with them, and this would violate every set of ethical rules set for doctors.
More than 115,000 Americans are on the waiting list for organs, and there are many geographical shortages. There is an unequal distribution of organs depending on where you live. The country is divided into 11 regions, and typically the organs donated in a certain region will stay in that area. Inevitably, organ transplants heavily favor the wealthy. Having money allows you to move to different regions where you are more likely to receive an organ. This favors wealthy people because they have the funds to take off work and move. Americans who cannot afford this are left to wait and often die as a result. This creates a large ethical debate because people are essentially manipulating the allocation system. The United Network of Organ Sharing manages the list of people across the country waiting for an organ transplant. UNOS has a complex matching system to determine organ distribution. Many factors contribute to whether or not an organ will be offered to you, including blood type, how long you've had kidney failure, medical urgency, where you live, and your size and weight compared to the donor. In general, the average time frame for waiting can be 3 to 5 years at most, and centers and even longer in some geographical regions of the country. Some factors that can determine how long you wait include how well you match with the available kidney, your blood group, sensitivity to high antibody levels, and how many donors are available in your area. Type O blood type has the longest wait. This is because type O donors can only donate to other blood groups, but a patient with type O can only receive an organ from a donor with type O. Prior pregnancies, blood transfusions, or past transplants make it more difficult to match with a compatible donor.
That are failing. We need some insight into the treatment options, including the different types of dialysis, as well as how to know when it's time to start dialysis. So let's start with a Kidney 101. You know, we talk a lot about balance in health, and your kidneys are the superstar of balance, whether it's fluids or body chemistries or blood pressure. Our kidneys orchestrate with other major organs to keep this delicate equilibrium going 24/7. All this while filtering out waste products created by our body's metabolism. So when your kidneys start to shut down, your body has a hard time keeping a balance. You might retain fluid or waste products, your potassium or sodium might become abnormal, your blood pressure might rise. This can all make you feel rotten and raise your risk for serious illness. So you need a new way to filter and balance your fluids and electrolytes, and this is where decisions about kidney transplant and dialysis come in. It takes quite a while to plan your transplant or dialysis, though. Your doctor will usually start planning for this when your GFR, which stands for glomerular filtration rate, a test of your kidney, is around 20. This is about the same as 20% kidney function. This doesn't mean you need to start dialysis, though. Most people start dialysis when their GFR gets below 12 or so. Actually, doctors are moving away from starting dialysis based on just a number. since this led to people starting dialysis earlier. And when we look back, these people actually didn't seem to do any better. So now, new Canadian guidelines consider your numbers, but recommend starting dialysis when you begin developing symptoms of kidney failure, such as severe fatigue, nausea, decreased appetite, and shortness of breath. However, this symptom assessment can be tricky, especially if you have other illnesses going on. So you need to work with your kidney team and your nephrologist, the doctors that look after kidneys, to figure out the symptoms that will improve with dialysis.
James Isuda, my grandpa, started his journey in 1983 when he was serving in the U.S. Navy. He was about to be sent on his first cruise to the Mediterranean Sea in support of the Marine Station in Beirut, Lebanon. Before being deployed, all the soldiers had to receive several inoculations to fight against diseases like malaria. As a result of these inoculations, my grandpa developed a disease called systematic lupus erythematosus. This means that his body became allergic to himself. Before he was diagnosed with lupus, my grandpa initially showed symptoms of arthritis. He was sent to the Navy Hospital in Mayport, Florida, where he was stationed at the time. As soon as my grandpa explained his symptoms to the doctor knew what was wrong. The doctor said that this happens in 1 out of 100,000 people. The Navy was aware of the potential consequences of inoculating its soldiers. However, the soldiers were never told of these potential risks. The Navy believed that since they signed up for the Navy that they should be willing to go along with whatever the Navy tells them to do. There is no cure for systematic lupus erythematosus, so my grandpa was discharged from the Navy and was sent to the Veterans Administration Medical Center to continue his treatment. The arthritis symptoms eventually disappeared for doctors only to find that his kidneys were slowly deteriorating. After 5 years, both of his kidneys failed completely. He then had to begin a regimen of renal dialysis. While doing dialysis, doctors took 42 tubes of blood so he could be matched with potential donors. Fortunately, my grandpa's brother was a 50% match and agreed to donate one of his kidneys. He had to be seen by a doctor every day for the first 6 months. But after the first 6 months, he only had to go every year once. Since it was only a 50% match, doctors expected the kidney to only last about 8 to 10 years. After 9 years of having his brother's kidney, it ended up failing, which made him have to go back on dialysis. He was on hemodialysis for 9 months before he received another kidney from a cadaver, which is expected to last the rest of his life.